Well, first we have to establish what a UTI truly is. So bacteria makes its way up into the bladder and causes those symptoms like burning when you pee, pressure, nothing's coming out, you constantly feel like you have to pee. But in order to truly diagnose a UTI, we really need to confirm it with a culture. So while your symptoms are pretty classic and it happens just once in a blue moon, we might treat that over the phone. But if you keep getting UTIs, at that point, we really need to confirm whether or not they're really infections. So for women who do truly have UTIs, so the symptoms of an infection, there's bacteria on a culture, we will treat those with antibiotics. There are some women who just genetically are more susceptible to getting infections. So in those women who keep getting infection after infection, we also will often do a workup to make sure there's not something in the bladder or the kidneys that's causing these symptoms or these infections. And then we'll start a low-dose antibiotic to prevent infections. Because once you've had, 3 in a year, or you're getting them more frequently than that, your bladder is broken. Your bladder has been hit so many times that it's easier for bacteria to get in and in. So we'll actually treat those with a low-dose antibiotic for 6 months to let the bladder heal. But backtracking a little bit, I'd say more than half of the time when we get a referral for recurrent UTIs, they don't have UTIs. If there's no bacteria, what the heck is going on? Why do I constantly feel like I have a UTI? So that's when we start investigating for other problems like bladder pain conditions, something called interstitial cystitis, where the bladder's inflamed for no reason. Maybe it's genetics, maybe it's diet. Those 3 Mountain Dews a day aren't doing any good for your bladder, and so we have to have a conversation about that. A lot of times it's the pelvic floor muscles. So we underestimate how much that muscle function matters, and if those muscles are tense or spasmed, they're pressing on the bladder and you constantly feel like you have to pee and it hurts, and there's all these other symptoms.